Todd and I met here in New York, and I feel like New York is sort of the basis of our story. My life before diagnosis was just full of hope and dreams and possibilities. I ended up just sick.
You know, that whole sense of well-being, I think she was kind of losing it a little bit.
I just thought it was something that was going to go away.
We went to the emergency room and they were looking at her and doing some tests.
The doctor told me that my white blood cell count was the highest she'd ever seen.
Ashley got diagnosed with CML. What they told us was it could be treated with daily medication, that she didn't have to do chemo or radiation.
We were trying to get my leukemia into remission, and it wasn't quite working the way that the doctors expected. And then he called me and he immediately said, I have to tell you it's not good news. And then he proceeded to explain to me that my leukemia had progressed to AML. I'm putting in an order to admit you into the hospital now, and you're also gonna have to have a blood stem cell transplant. The long life that I thought I was gonna have, I no longer thought I was gonna have, and I might not survive this. I had my transplant in August of 2020. It turns out that my older sister ended up being my donor. My recovery after transplant was the most challenging portion of my leukemia transplant journey. Things were happening in my body that were really uncomfortable, really ailing. I was really sick. And then somewhere between Thanksgiving and Christmas, I started to feel a little bit better.
There was this period after her physical recovery where she felt a gap, that there was something she was missing. She would say to me, you know, I need to make more cancer friends.
When I think about my transplant experience, I really feel as though I dealt with it physically for about a year or two, and then I really started to deal with my experience emotionally and mentally.
The NMDP Patient and Caregiver Emotional Support Program, also known as NMDP PACES, is a free individual and group support offered to patients and caregivers throughout treatment. It's a place where they can receive support around the emotional health consequences of transplant and of caregiving, and to really receive support from someone who understands what transplant entails.
This process can be more intense than people realize, and there can be a lot of big changes that come with it.
For some people, they really struggle with anxiety and fears of the future when they're pre-transplant. And then many also struggle with survivorship challenges. This could be identity changes or relationship dynamic shifts. Patients can access support through the NMDP PACES program at any point throughout treatment. So this can be really from that point of diagnosis, and it can also be years into survivorship.
The wildest experience of my life, being able to share that with someone else, is priceless.
Patients come to us and often say that they feel like the rug was pulled out from underneath them.
And so we really want to be there for them in whatever way that might look like. We offer up to 8 sessions of free counseling to have someone who can hear your story and be there for you.
We also offer survivorship chats, our virtual support groups that are available for patients post-transplant.
The survivorship chats and NMDP's role in Ashley's recovery has been really important. Really, the mental recovery from it is this whole separate journey.
Haley, who I've worked with for a couple years now, she's really able to use her expertise as a social worker to really help us move forward. We talk about therapy, we talk about physical fitness, we talk about boundaries.
Ashley is an incredibly resilient person, and she is very honest. She brings a lot of life and levity to the survivorship chats, and she's also very real and honest about what survivorship looks like.
So often she'll come out of a chat and say, I just feel so good. You know, I feel so happy that I've been able to help someone.
I know where I'd be if I didn't have the program actually, which is I'd be where I was 3-4 years ago. All that I was really scared about losing, the dreaming and the hoping and the fears. Now I'm dreaming and hoping again, and I just took a different pathway here than I expected. I'm really, really excited for the future. And I love my life now.